Okay, today we are going to talk about gout. Now, gout is referred to the disease of kings and rich man's disease because it has been historically associated with a diet rich in meat, alcohol, and seafood. Now, foods that were typically accessible to royalty, to rich people in the past. Surprisingly, King Henry VIII used to have this huge banquet meals, and during that time, he would suddenly get this excruciating pain in his toe, and he would limp and say, "Oh, damn that gout," and walk out. So at that time, it was royalty and the kings who got this. But the queens at that age, the younger age, did not get it. And I'll tell you why as we move forward with the story. So, having said that, we come across what happens. Gout is a common and it is a form of arthritis. Sudden, severe attacks of pain, swelling, redness, tenderness in the joint, mostly in the big toe, but not necessarily always in the big toe. Now, an attack of gout can occur suddenly. So a person is perfectly healthy, but he's eating whatever he wants, and suddenly he gets this acute attack of gout, which wakes him up in the middle of the night. We will also let you know why it happens so suddenly in the night, with the sensation like your big toe is on fire. I mean, I've seen patients who have begged me, do something right now. The pain is so excruciating and it is so hot and swollen. People who are listening and who had gout can understand this. That even the weight of the bed sheet on your toe is intolerable. So it is excruciatingly painful. Having said that, let us go on to the next one. So here is what you have, the signs and symptoms of your gout. And we will look at the intense joint pain. I mean, you normally have your big toe, but you can have your ankles, your knees, your elbows, your wrist, and your fingers involved. And the pain is excruciating for the first 12 hours, and then it sort of lets go. But then you have this lingering discomfort, which may last you for weeks. And then, if you're not careful and you're not treated yourself, and you're not changed your diet, then the subsequent attacks are going to last longer and affect more joints. Now, the joints are swollen, tender, red, like you see around here. This is a typical gout in your toe. It's not really in your big toe, but it is in the bunion area. You can see this, or it can happen even in your elbow. Then if this continues, then there's a limited range of motion for that particular joint. So these are the signs and symptoms. So if you get up in the morning or in the night, if it gets you up, and you see this swollen red joint, think about gout. Now, here is a caveat. If you remember this, it's a take home point. If you have joint swelling anywhere in your joint, and there is pain and redness along with fever, chills, fatigue, be careful. That may not be inflammation, that may be infection. And you may get septic arthritis, and that is terrible. So you have to get IV antibiotics. So if you have had gout and you get repeated attacks, you're bound to know this is gout. If it's a first attack and you're not sure, please visit your doctor and talk about this. Do you think it is something else than gout? Because we will talk about the diagnosis. So that will help you as to what to see. Every time I give a talk, it's how you approach your doctor if you have this problem, or if your friends, family, or co-workers or colleagues have this problem. We go next. Next is the causes. Remember, simple thing. Gout occurs when uric acid crystals accumulate in your joint, causing inflammation and intense pain of a gouty attack. Generally speaking, there is too much uric acid produced by the body, or too little uric acid is excreted via the kidneys. Only two things: too much produced, very little excreted. Now, when you have, how do uric acid crystals? If you've got too much uric acid, which has not been able to, you're not excreting, or that's too much uric acid, it'll form uric acid crystals. Your body produces, how you get uric acid? Your body produces uric acid when it breaks down purines. These are substances that are found naturally in your body. But purines are also found in certain foods, including red meat, especially organ meats, liver, spleen, heart. And there is also purine-rich seafood in anchovies, sardines, mussels, scallops, trout, tuna. And then you have purines in your alcoholic beverages, especially with your beer, which has a lot of uric acid. And therefore, sweetened drinks, your sodas, your Pepsis, or your Cokes, and all that, can also cause increased uric acid. Normally, uric acid dissolves in your blood and passes off through your kidneys. So what happens? If you got too much, it'll form crystals. You cannot excrete it, it'll form crystals. And these crystals are like needle shaped. These are that negative bifringent, but forget all that. These are needle shaped crystals. Why am I telling you this? Is because this is one of the diagnoses of gout. Let me tell you one thing. There are a lot of people who have gout, they're misdiagnosed. There are a lot of people who do not have gout, and they're misdiagnosed, and they're labeled as gout. So you got to understand this and pass on this message to others of what to expect in gout. Now, uric acid levels. Normal levels of uric acid in the blood are what? For man, it is 3.4 to 7 milligrams per deciliter. For women, it is 2.4 to 6 milligrams per deciliter. But here is a catch. Generally speaking, gout occurs when you have high uric acid in your blood. Everybody knows that. But gout can occur with normal uric acid level. That means if a lady has got, say, 2.7 milligrams of deciliter, which is absolutely normal, but ladies don't usually get it, but a menopausal lady, or a man who has got, say, 4.2 milligrams per deciliter. And that means that this is normal uric acid level, but you can still get gout. So if you get a swollen joint, think of that, even if your uric acid is normal. Number two, I have seen doctors do this. If you go with an acute gouty symptom to your doctor, they will check your blood. Uric acid levels are generally normal during an attack of gout. If you have to have checked, have it done later on when your acute gout symptoms are over, 2 months, 3 months down the line. And in some people, like I said, high levels of uric acid, say for a man, it is say 8.2, not precipitated in gout. But these are the outliers. Generally speaking, uric acid level high is equivalent to getting gout. So far, so good. Now let's go on to risk factors for gout. First, if your uric acid is high in the blood, first important thing is your diet. Consuming foods and drinks high in purines, such as your red meat, your organ meat, like seafood that we talked about, your alcohol. These foods are rich in purines and are converted into uric acid. Now, I remember in my days as a young doctor, we used to tell patients not to have anything which was rich in purines, even veggies. But research has shown that plant foods rich in purines, like your lentils, your beans, your chickpeas, your veggies, your spinach, your asparagus, your mushrooms, all these are rich in purines, but they're not implicated in increasing your uric acid levels. Check it out. If you do not believe me, check it out. This has got nothing to do with your gout. And the reasons we will go through it, why plant foods, purines do not cause gout, as opposed to purines in meat products or seafood products. Number two is your obesity. Excess body weight increases uric acid production and decreases the kidney's ability to eliminate uric acid. Medical conditions. If you are having high blood pressure, diabetes, or your cardiovascular disease, these are linked to a gouty attack. And we have talked in my past talks, and you all have, some people know about it. If you have a whole food plant-based diet, you can reverse or prevent diabetes and high blood pressure. So the chances of getting gout becomes less. Medications. Oh, I've seen this. Like your diuretics. If you use excessive amount of diuretics, people use this because the first line of treatment in blood pressure is medication. And then people will come with an acute attack of gout. There are thiazide diuretics. Aspirins can do this. Certain immunosuppressants can do it. They can all raise the uric acid level. A family history of gout, more likely that you can get gout. Age and sex. Gout is more common in men than in women and often develops between 30 and 50 years of age in men. The reason being that when a man reaches puberty at the age of 15, 16, 17, 18, what happens? The testosterone levels increase, and this is in some way responsible for increasing the uric acid. Therefore, for the longest period of time, it was called as a man's disease. And trust me when I tell you that in my 40 plus years of practice, I've rarely seen women get this disease before menopause. Because an estrogen is a protective, endogenous estrogen. Your body's estrogen is a protective mechanism for preventing gout. Once you reach menopause, all bets are over. Now you can get gout as often as men. And therefore, coming back to it, the young kings got it, where the young queens did not get it because of the estrogen protection. All right. So we come across recent surgery or trauma. This can cause gout if your uric acid levels go, and dehydration. The moment you are not having enough fluid in your body, your uric acid crystals form and you can get a gouty attack. So we go on to complications. What happens when you do not change your diet, when you do not take your medications, if you don't want to change your diet? You can get recurrent gout. And some people may never experience gout after the first attack. Others may experience several times each year. If untreated, gout can cause erosion of the joint and destroy the joint eventually. Number two, if your kidneys cannot eliminate uric acid, if your kidneys cannot eliminate uric acid effectively, it can cause uric acid stones to be formed in your urinary tract. And then all these problems about renal colic and having severe pain because of the uric acid stones. And then advanced gout. If you have advanced gout, then there is every likelihood that you can get deposits of urate crystals to form under the skin, and they form nodules, which are called tophi. Can you see the tophi over here? They can form in several areas: fingers, hands, feet, elbows, your Achilles tendon, there's the back of your ankle. Tophi are generally not painful. When you get an acute attack of gout along with the tophi, those tophi turns that start getting tender. And I've seen a lot of patients with tophi. These are not properly diagnosed or properly treated. So your next question automatically will be, how would you get the diagnosis? Say you are a person 35 years old and you get a severe, your big toe is swollen, as we showed you in the picture. What will your doctor do? Your doctor should Your doctor should be able to use a needle to draw fluid from the affected joint, and then you can get what I showed you initially, those needle-shaped crystals, which you can see under the microscope. They're called negative bifringent under polarized light, but you can see those. Number two, blood tests. You may recommend blood tests, but not to be done during the acute gouty attack. And we have already said that you may get high uric acid levels and you may never get gout, or you may have very low uric acid levels and you may never get you may get gout. Then you have the X-ray imaging, which is very helpful to rule out other causes of inflammation, osteoarthritis, or maybe a septic joint. And so finally, ultrasound, when you can see those tophi, urate crystals in joints or in tophi, these are there. But I think the most important is a joint fluid test that will show these crystals. Then you can say, yes, this person has gout. If you cannot see that, the doctor, then you have differential diagnosis of everything why the joint is swollen, from osteoarthritis to a septic arthritis. has to be ruled out. Okay, next, treatment. So let us look at a very factual thing. If you are having an acute attack of gout, I'm not going to ask you to take a certain vegetable or this and that. No, this is an acute attack. You need anti-inflammatories, you need corticosteroids, you need pain medications. Fair enough. This is an acute attack. Get everything done to bring this attack down. But once this attack is over and you're leading a normal life, now think about avoiding foods high in purines. Avoid alcohol beverages and sweetened drinks. You have to avoid foods with red meat, organ meat, liver, and all that, which are high in purine. And seafoods that we talked about, anchovies and whatnot. You have to do this before you think about medication. You got an acute gout attack, you start doing a proper diet treatment, and you may never get it again. But if you do continue your diet, there's every likelihood that you will get it again. Number 2, exercise regularly and lose weight. Keep your body at a healthy weight that reduces gout. And if you have joint problems, then low impact activities like walking, biking, swimming, which can be a little easier on your joints. But remember, what I'm saying is, you got an acute attack of gout and your doctor says, look, to prevent further attacks, I'm putting you in medications, and this is your first attack, ask your doctor. I'm going to go on this whole food plant-based diet and see if I get another attack. Now, having said that, you can, if you get another attack, which in my opinion you will not, but if you do get another attack, then you're thinking now about medical treatment, drugs. And so, what are these drugs? You have medications that treat gouty attacks. And therefore, to treat those, we have non-steroidal anti-inflammatory drugs. Your ibuprofen, Motrin, naproxen, you all know about it, very strong anti-inflammatory, Indocin, Celebrex, all this can be used. But again, remember, when you use those heavy anti-inflammatory, be careful about your bleeding and ulcers in the stomach. If you had gout, you will definitely know the name colchicine, which also is very good at anti-inflammatory, and it reduces the gout pain tremendously. But the fact is, maybe the effectiveness may be offset by severe side effects. 50 to 60% of my patients don't take it, even if they're because of nausea, vomiting, and severe diarrhea. And then finally comes your corticosteroids. Again, these do not take it very often because they are the ones which increase your blood sugar, elevates your blood pressure. So be careful, but you need to have something to reduce your pain and swelling. Now, say you've done a course, you got an attack, and now you want to prevent it. So you're taken to whole food plant-based diet and you're not getting any attacks. Great. If you still get attacks, then there are medications to prevent gout complications. And you may have evidence of damage due to gout with x-rays. And so the medications should be that block uric acid production or improves uric acid removal. So these are the two medications. If you have gout, you heard the name allopurinol. Now, these are the ones which does not prevents from uric acid production, it decreases the uric acid production. And there are medications that are like drugs that can improve uric acid removal. And those are the probenecid. They can remove, but there is a chance of getting uric acid kidney stones. Now, having said that, this treatment, I wish people who have gout will never get to the fact of using this allopurinol or probenecid, because I think if you have a healthy diet, exercise, lose your weight, and those things will prevent you from getting another attack. Avoid alcohol. And then we have, so these are your treatments with what I've told you. And remember, if you have a doctor, you go with acute gout and does not find those needle-shaped uric crystals, ask him, do you think I have pseudo gout? And what is pseudo gout? Pseudo gout is similar in presentation as gout, but the crystals that are formed are different. They are not uric acid crystals, but they're calcium pyrophosphate dihydrate crystals as opposed to urate crystals. And it does not affect very much the large toe or the big toe. It affects the knees and less often the wrist and ankles. But here is the thing, that your risk factors are that age, which we had in gout, joint trauma, genetic disorder, but excessive calcium and iron in the blood. So if you've got diseases or endocrine problems like an underactive thyroid or hypothyroid, or an overactive parathyroid gland, which produces a lot of hormone, parathormone, that increases the calcium in your blood. And then there are likelihood that you have chances of, if you've got a swollen joint, it can be pseudo gout due to this calcium pyrophosphate crystals. Treatment is generally the same. Acute ones, you have to use your anti-inflammatory and what else. Again, with this pseudo gout, abstaining from all those meats and byproducts of meats like your heart and spleen and what we talked about, plus a whole food plant-based would give you a chance. Now, contrary to, I believe that dairy is not good, generally speaking, as a whole food plant-based diet person proponent. But dairy is not implicated in gout. In fact, if you have low-fat milk or dairy, it helps with the elimination of uric acid. Now, I'm not saying that you should have dairy if you've got gout. No way, because you don't want to jump from the frying pan into the fire. So I believe that you should be able to monitor what I've just told you. So in plant-based purines versus purines from animal sources. Now, plant-based purines are less likely to increase uric acid levels as the body metabolizes plant-based purines differently. You see, these have high fiber, so it helps in the excretion of uric acid through the alimentary canal. Then plant-based foods are anti-inflammatory. They're rich in antioxidants, phytochemicals, even if they're rich in purines. So it may help not getting your gouty attack. And they have lower fat content, plant-based. A high-fat meat diet impairs kidney function, as we have already talked in my previous talks. and reduces the ability to excrete uric acid. So it's a win-win situation. If you have a plant-based, and if your doctor says, oh, that's also high in purines, tell him, no, these are not implicated. Why does gout attacks generally occur in the night? This is not that important, but some people have asked me in the past about this, that I always, whenever I get a gout attack, I'm woken up in the middle of the night. See, these are explanations, possible explanations to why it happens in the night. See, your body temperature generally drops during the night, correct? Yes. Cooler temperatures promote uric acid crystals to be formed in a gouty attack. Number two, dehydration can play a part because you don't drink water when you're sleeping for several hours. So lower water levels or fluid levels in the body can concentrate uric acid in the blood and joints, increasing crystals. Cortisol, a hormone that you use for acute attack, it's an anti-inflammatory. It is produced by the body, is at its lowest level during the night. So lower cortisol levels may reduce the body's ability to manage inflammation. And finally, joint immobility. See, joints are less active during the night. So what happens is that if you are less active, there's decreased blood flow and accumulation of uric acid in the joints. And having said that, so your take-home points, what you should remember is, first of all, be certain that you have gout. That's the first bottom line. Somebody should be able to see the uric acid crystals and then label you as that you have gout. I've seen in my practice a lot of people, oh, I've been told that I have gout. Oh, did they do any test on you? No, no, no. They just told me that because your joint is swollen. No. Number two, avoid meats, seafood, and alcohol. These foods are rich in purines and can increase your uric acid levels. Veggies, beans, and legumes, nuts, and seeds are rich in purines, do not increase your uric acid levels. We talked about it. You go with an acute attack of gout, don't get your uric acid levels because they'll be normal. You can have high uric acid levels and not have gout, or you can have normal uric acid levels and can get gout. Next point, extremely important, an inflamed joint, swollen, tender, redness with fever, chills, and fatigue should be taken very seriously. And a whole food plant-based diet is the best way, in my opinion, to prevent further attacks of gout, as well as prevent and treat and reverse other chronic diseases that can precipitate gout, like your blood pressure, cardiovascular disease, high cholesterol, and all that. So with that, I'm going to end my talk, and I am ready for questions.
All right, that was awesome. Thank you. Now, everyone, it's time for question and answers. If you would like to come on camera and show yourself, we're going to put everybody in gallery view. Thank you for being here. Okay, everybody should be able to turn your cameras on. And when you do, you can raise your hand, you can put your question in the comments, or you can come on screen and ask your question. So don't be shy. We want those questions. Debbie, yes.
So, Dr. Akil, what about tart cherry juice? I heard that that was very beneficial for folks who have gout. And are there other foods that are real? I mean, besides the whole food plant-based, are there specific foods that can help with gout?
Yeah. See, for example, if you look at the cruciferous vegetables, that can help. Cruciferous, you're talking about a cauliflower or a broccoli head. These have anti-uric acid properties, so they can help. Your carrot distinct, very true. So I do agree that these foods can help, but my main idea is that people stop eating these vegetables, veggies, because the doctors say that these are high in purines. It doesn't make a difference if veggies are high in purines. Uh, and I think just taking exercising, reducing weight, lots of fluids, abstaining from sugary drinks, and doing your whole food plant based, not entirely if you, I'm just talking, you're not going to get gout. But particular foods as such, yeah, all I can think of is cruciferous that are there, which are very much in.
Awesome. You know, it comes to mind, Dr. Akil, you mentioned foods high in purines, and even though there are some whole food, plant-based foods that are high in purines, they don't create uric acid. What are purines?
See, purines are substances that are formed by your body. These purines are, and these substances are also found in foods. Now, if you're obviously making more purines, your body makes more purines, then you have to do other things besides just your diet. Because even if you're on a very strict diet and you're not taking any purines, you avoid meat and all that, your body may be producing more. That is a time when conventional medicine comes into play. That you have to stop this production of uric acid in your body. But these substances which are there in most of the cases that I've seen in my last 40 plus years is people who are heavy on meat diets. They have their 6 cans beers a day, and they hardly are having any fluids except for the beer. And so they get an acute attack. And it's people who listen to what doctors say and do the right thing, they rarely get. I may have got a few people who, even with all proper diet, they've got it. Then, of course, you have to put them on so that your uric acid production is less, or if your increase of excretion. So you put them on those medications and watch them. But they all have side effects. But that's being unlucky.
Well, we had, unless Mary, did you have a question? You want to unmute yourself and ask your question?
Hi, can you hear me?
Yes.
Oh, okay. Thank you very much for this great presentation. And I wondered if there's any concern with having a uric acid blood level that's lower than the normal range.
Absolutely not. You can have a lower level of uric acid without any problems at all.
Good.
But you can have a lower uric acid level, and rarely you can get gout too, which I mentioned in my talk. So be careful. I mean, just because your uric acids are lower than normal, and then you say, I'm never going to get gout. No, you can get, but very rarely.
Thank you.
Awesome. Dr. Manisha Shah had a question. First, she says, thank you, Dr. Akil, for a wonderful session. Should we treat high uric acid levels to avoid gout?
I think that if you got high uric acid levels, you should not be worried if you're not getting gout, but try and lower the uric acid levels by what I mentioned in the diet part of it. Not medications to lower it, but the diet issue, if you can do that and lower it, great. And if you're still high, like I said, if it's still high and you're not getting any problems, that is okay. But Dr. Manisha, Dr. Shah, you're right. When you have that high level, you never know when you may get gout. So try and reduce it by avoiding foods that have high in purines, meat products, and increasing your fluid levels, exercising, and so you'll be great. You'll get it lowered down.
Awesome. She had a second question. Is there any connection between fructose and uric acid?
Yes. Fruit juices sometimes can cause high uric acid levels. So if you are having very high uric acid levels, try and abstain from fruit juices because it is fructose from any source that increases your blood sugar. So you are right.
Awesome.
Milk is not implicated. I was a little surprised when I was doing my research.
Milk can cause all kinds of other things, but not gout, huh?
True.
So, Francine, hi, Francine. You had a question. Would you like to ask your question?
Yes, excuse me. I wondered for sure what other foods contain the high purines. You mentioned organ meats. I think you mentioned the fruit juices. Are there any things other than meats? Are there any other substances?
Seafood,
Oh,
clams,
seafood.
scallops, anchovies, certain fish products like your trout, they have very high uric acid.
Tuna too?
Yes,
Tuna, okay.
yes,
All
yes.
right. Well, thank you. I've never had gout. I'm not sure I know anyone who has other than just casually. But it's always good to know what you can do to avoid it or stay healthy. So I appreciate that.
Not at all. And this is the main thing that, like I said, I probably can count on my hand the people premenopausal or before menopause women who I've seen have gout. They don't get it. It's
Mhm.
estrogen protective. Or once you reach menopause, all bets are off. So you get your gout as much as we get. And that is why the curse of the kings.
Mm,
Wow. Okay.
very interesting.
So
And
would it be accurate to say that purines are not really in foods? So if you eat the whole fruit as opposed to the fruit juices, would that be a problem or not?
I think sweet fruits also can be a problem. It's a juice. Now, when we say fruit juices, it has a double-edged this thing because not only you have fructose in the fruit, but you're also talking about the added sugars.
Well, if you do a whole fruit, you wouldn't be adding anything.
Oh, correct.
Yeah, that's what I meant. Yeah.
Juices can be because of both, but you have a very valid question. I don't have a response to that complete because fruits can be taken, but they still have fructose, and it is a fructose that causes increase in uric acid.
Okay. Thank you for that.
Not at all.
thank you. And hi, Jan. It's good to see you again. Jan put in the comments, thank you for doing these presentations. Each one is so informative. I really appreciate you taking the time to educate us, as do we. And I look forward to these each month. I do too.
Yeah, yes, they're just great. I always set it on my calendar, and I'm always so happy because I learn so much. I'm a nurse, and I still learn so much. So thank you.
No problems. I'm a doctor and I'm still learning.
That's the good thing, right? That's what makes life enjoyable.
Absolutely.
Every day is a learning curve for everybody.
Yes.
And we should pass. I am going to do in July because a lot of emails I've got about backache.
Oh, wonderful.
When
Good.
should you go in and be worried about it? When is it just a muscular pain? When should you go for surgery or when should you go for your physical therapy? We'll cover basics. I'm not going to get into depth of what an orthopedist and we talk a little bit about herniated disc and prolapse. But I think it should be
Yeah.
enjoyed. Don't you think so, Lynn?
Oh,
Yes, that's a good one.
yeah, yeah.
It's
I,
common.
I had another question, not on this topic, but I wonder, Dr. Tahar, do you see individuals like virtually? Do you have any setup to do that outside of your clinic?
I don't have outside of my clinic, but if there is something, a pressing problem or a pressing question somebody has and cannot get hold of their own doctor in time,
Mm-hmm. Mm-hmm.
then I would be very happy to answer, provided the person first sends me a text, because I
Okay,
don't pick up otherwise, at times.
sure.
I've attended your
Good.
talk, somebody has attended your talk and has asked me, and I have a problem. I get these texts all the time.
Oh, okay. Thank you.
Hello.
Yes.
Hi, my name is Gail, and I'm also a registered nurse, and I'm really appreciating this talk that doctor is doing. I do not have gout, but I do know a couple of people with gout. Now, one person that I know with gout, already, he has some kidney disease. And I know that he's not plant-based. Is there any way with going plant-based that can help this situation of kidney disease? I don't know if it could be reversed or what, but what can you add to this, doctor?
Okay, if the kidney disease is basically due to uric acid stones, then it can definitely help. But if your kidney disease is, say, secondary to other things, like taking a lot of anti-inflammatories and things like that, then no. But if it is uric acid and the person has gout, most likely the person that you're talking about has kidney problems because of the uric acid. And going on a plant-based food diet will definitely stop the production of that much of uric acid and will help him with the kidney problems. Yes, it will. And are you from California, right?
Yes, I am.
Yeah, I just remembered we had a talk, right? A few days back.
Yes, we did, and I certainly appreciated that call.
On Father's Day, correct?
Yes, it was. Yes, it was.
Yeah, but lovely, lovely. It's nice to have you, my dear.
Thank you.
Okay.
Good
Thanks,
luck
everyone. Thank you.
and thank
Thank you.
you.
All
Thank
right.
you.
We'll see you next month. There will be an email with the exact date and the title and all the information. Please do share. We'd love for more people to be here with us. We know how great this information is. And if you're part of a group or association or any way that you are connected with a group that you can share the information with them, that would be awesome as well. So thanks, everyone. We'll see you
Thank you.
next time. All right.
Thank you.
Bye-bye.
Bye-bye.
Thank you.